He assumed there was a valid risk of causing cancer, and as a cancer researcher, he wanted to know for sure. In 1954, he conducted his first experiment by injecting a leukemia patient with HeLa cells to see if they would cause tumors to grow. None of these patients knew they were experimentation subjects, they all thought the injections were for testing. Some patients grew tumors that later were surgically removed, and some tumors grew and vanished on their own. In 4 patients the tumors grew back, 1 patient died from the HeLa cancer. The next question for Southam was, would this same thing happen in people who did not already have cancer? Therefore, in 1956 he started looking for inmates to test. This time, the test subjects knew they were having cancer injected into them. In all cases, tumors began to grow, but as these men were all healthy and cancer-free, their immune system fought off the cancer. He tested a mixture of cancer patients, gynecology patients at Sloan Kettering Institute for Cancer Research and others by injecting them with the cancerous cells. In addition, as he was not their doctor, he did not feel he needed to disclose this information. It was not until 1963, when he was doing a study on cancer at the Jewish Chronic Disease Hospital, that he eventually faced doctors who refused to continue without the patients having full knowledge of the research and giving their consent. They reported him to the regents of the University of the State of New York, and an investigation followed. During the investigation drive, Southam defended he believed the patients faced no risk of harm. However, the Board of Regents of the University of the State of New York found him guilty of unprofessionalism and deceit.